Now, at first glance, skin tears look small. Just a little flap, a little cut. People shrug them off thinking it's nothing, it'll heal on its own. But the truth is, skin tears are often the start of much bigger problems. So in this video, I'm going to break down exactly why skin tears matter, how to treat them the right way, and what you can do to prevent them from turning into long, stubborn wounds. Because most people think of wound care as dealing with dramatic things, deep ulcers, big infections, surgical wounds. But the small wounds that you think you can ignore, those are often the ones that come back to bite you. And skin tears are a perfect example of that. For those who don't know me, my name is Dr. Cassandra Voltaire. I'm a family medicine physician trained in wound care. I spend a lot of my time in skilled nursing facilities, outpatient clinics, and I've had so many experiences with skin tears that have turned into something much worse. I've seen it so many times. Someone gets a skin tear, usually on the arms or the shin. It looks small, but it's painful. They slap on a bandage, maybe some ointment, and a week later, instead of healing, it's red, weepy, or spreading. Suddenly, we're not dealing with a little tear anymore. We're dealing with an open wound. So if you've ever wondered, why do these little wounds get so out of hand? It's actually the result of a few mistakes you might be making. A skin tear happens when the top layer of the skin, what we call the epidermis, literally peels away from the layer underneath. It's not a clean slice like a paper cut. It's more like the skin has been pulled apart. That is important because as we age, our skin loses elasticity. It gets thinner, drier, and more fragile. So instead of bouncing back from trauma, it just breaks. Think of it like tissue paper. When you're young, your skin is more like construction paper. It can take a little force and still hold together. But as we age, it becomes much more delicate. Even brushing against a piece of furniture or removing a piece of tape can cause it to tear. Now that might not sound like a big deal, but here's the catch. Skin tears aren't just injuries to the surface. They disrupt the protective barrier. And when that barrier is weak, infection, delayed healing, and even chronic wounds can follow. I'll never forget one patient, an 83-year-old woman who came in with what her family thought was a scratch on her shin. But when I looked closer, it was a skin tear that had started to dry out, curl up, and stick to the bandage they had been using. Every time they changed the dressing, they were actually reopening the wound. What started as a minor tear had turned into a persistent, painful wound that needed weeks of specialized care. That's the trap. So let's talk about what makes skin tears so difficult. First, the location. Skin tears usually happen on places with thin skin, arms, shins, hands. These areas don't have much padding. Blood flow can be already limited. That slows healing right from the start. Second, the cause. Skin tears often happen in people who are already vulnerable. Older adults, people on steroids, people with poor nutrition, or those who are on blood thinners. All of those factors make the skin weaker and healing slower. And third is management. A lot of well-meaning caregivers and even providers don't treat skin tears with the same care they would a larger wound. They'll use rough tape, change dressings too often, or let the wound dry out. And each of those things makes healing harder. So what's the right way to treat a skin tear? Here's how I usually approach them. First, if the skin flap is still there, don't cut it off. Gently ease it back into place, like closing a book cover. That skin can actually help protect the wound and speed up healing. Second, avoid anything that sticks too much. No regular adhesive bandages if you can avoid it. Use non-stick dressings or even silicone-based dressings that don't rip the skin when you remove them. Third, keep the wound moist, but not soggy. A moist environment helps cells move and repair, while a dry environment makes the wound crust over and delay healing. And finally, protect the surrounding skin. Skin tears are often surrounded by tissue that's just as fragile as the wound itself. So use gentle cleansers, moisturizers, and be cautious with adhesives. Now, prevention is where the real magic happens. Most skin tears are avoidable by paying attention to the little things. Keep the skin hydrated. Dry skin tears more easily, so daily moisturization is key. Be careful with transfers and mobility. If someone is using a walker, make sure their arms aren't bumping into it. If they're in a wheelchair or bed, pad the sharp edges. And watch out for tape. Honestly, tape is one of the biggest culprits. I've seen more skin tears from medical tape than from actual accidents. So if you can, use alternatives like paper tape, mesh neshing, wrap, or silicone adhesives. Let me pause here for a moment. If you're new to wound care, just remember this. Skin tears are not minor. Treat them like real wounds, because they are. If you're more advanced, you might already be thinking about classification systems like the Payne-Martin system or the I-STOP system, or whether the tear is partial or full thickness. That's fine, but never lose sight of the basics. Protect, moisturize, and avoid trauma. And if you're a caregiver, here's the simplest thing you can do. Keep your loved one's skin soft. Lotion every day. It's not just comfort, it's prevention. Now let me tell you about a mistake I used to make. When I first started managing skin tears, I thought airing them out was good. I'd leave the wound uncovered to dry out. I thought I was helping, but what actually happened was that the wound edges dried, curled, and became brittle. Healing slowed way down. Now I know better. Wounds need moisture. Covering and protecting a skin tear isn't about hiding it. It's about giving it the environment it needs to repair. So let's bring this together. Skin tears might look small, but they demand respect. They remind us the body's barriers are fragile, especially as we age, and that sometimes the smallest injuries have the biggest consequences. If you're caring for someone with fragile skin, prevention is everything. So moisturize, protect, and be gentle with adhesives. And if a tear happens, manage it with care. Don't underestimate it, because ignoring a skin tear is like ignoring a crack in a dam. At first it seems small, but if you let it go, it can lead to something much harder to control. The hardest wounds to treat are the ones that ask you to juggle competing truths. You can't push too hard in one direction without causing harm in another. And that takes patience, humility, and sometimes the courage to say, we need a team. And now that you know how skin tears happen and what makes them painful and annoying, if you knew how to clean these wounds the right way, it allows them to heal much faster. And there is actually something that I've started doing recently that's helped me speed up the time it takes for wounds to heal significantly. So watch this next video where I show you what it is, how it works, and how you can use it to treat your patients faster. Stay informed and heal well.